I think on that note, where Mahaketla ended his report, let's now go to the Transport Department spokesperson, Ayanda Allie-Paine, who's joining us on the line. Good evening, Ayanda, and welcome to The Full View. Listening into what Mahaketla had said there earlier on, he says one of the concerns that commuters have raised is that there are no sanitizers at these taxi ranks or within the taxis as well. What is the department doing in that regard?
A very good evening to you, Aljan. Good evening, Sapita, and to your viewers. Thank you very much for your time. As you can imagine, these are quite different times that we're living in, and it might be a bit of a shock to the system to now have taxi operators looking towards investing in hand sanitizers. We know that some of the major taxi ranks do have restrooms or ablution facilities, but perhaps questions of having soap and water and hand sanitizers never surfaced in the past, and now they have to relook at these things. Minister Mbalula will be engaging with Santaco, a number of mother bodies, taxi associations, and operators themselves to try and bring about an awareness campaign, an education campaign that also targets the commuters. So first and foremost, getting information out there. Secondly, getting some sort of funding in order to make sure that there are resources available, and that will have to come from the operators. And we're quite happy that there's a general willingness from them to work with the department. And so Minister will be having those discussions with them and deliberations to find out how we can assist, because of course it is an independent entity, it is a private sector, but we have to have a sort of responsibility because it is a public transport sector. So those discussions will come through, and of course it is top of the agenda with regards to the minister's mandate of making sure that he takes part in mitigating the spread of COVID-19.
So does this mean that the minister goes into that conversation with absolutely no demand from the taxi association?
I think demand is a strong word, but I think the request that Minister has is for them to work with the department, work with government. And we have seen in the past, especially because conversations are at an advanced stage about whether we professionalize the industry, about subsidizing the industry as much as we do the bus industry. Minister Mbalula is embarking on a national taxi indaba that's already begun provincially, and we are having rigorous stakeholder engagement with people in the sector. So there is a cordial environment within which this request from the minister is being made. And again, like I said, there is a general willingness to work with the department on the part of taxi operators. And so it is one that we don't think will be met with resistance at all.
Why is it that the department is not setting up, for instance, screening facilities at these taxi ranks? I think that's quite important. Help the taxi drivers as well, so that they know also what to look out for. You've heard from the Q Marshal earlier on as well, speaking about opening and closing the doors. How do you get them also to have that level of intellect as well as knowledge about what to look for in terms of symptoms relating to the coronavirus with the necessary equipment?
100%. In fact, that was one of the announcements that Minister Mbalula made today, to say that they will be screening facilities that are placed at major taxi ranks, as well as your trains. We can't forget them, and your bus stations as well, wherever there will be an exchange of money. Because you know, Aljan, that money carries a lot of germs. You wipe your nose, you hold the money, perhaps you cough into your hand, you hold the money. And if it's a taxi and there's 4 mashlalisane, that money that comes from the back seat makes its way to the driver who gives you change. Before you know it, the entire taxi is affected. Yeah. And so Minister Mbalula will most definitely be setting up those screening areas where people can be checked for their blood pressure.
I'm sorry, Ayanda. The minister spoke about random screenings, and random screenings are not mandatory screenings, so that's quite different. It doesn't seem as though that there is a holistic view that says that wherever commuters converge, there must be screening that takes place as a matter of fact and a matter of urgency.
Remember that this is a multifaceted and multidisciplinary approach. So it will not just be taxi ranks. Wherever people are, wherever you find government departments, be it home affairs, be it the health facilities that are out there, be it the schools and other areas, they are all going to be holding hands and making sure that at some stage there is an availability of screening facilities, not just your taxi ranks.
Okay.
And so working together with other departments, we will then ensure that if there is an area that's a hotspot, based on the data and the statistics that are given to us by the health department that is leading this initiative, we'll be able to go there. So, for example, if the Minister of Health says we've picked up there's a problem in KZN, that's where the Department of Transport will also zoom in and make sure that we bring in all facilities to try and nip it in the bud and curb the spread. Because if we then say every single taxi rank in the entire country will receive screening services and personnel, that might be something that is unmanageable and unsustainable. You may find in the rural areas that there's absolutely no need, and the hotspots are maybe the townships. We don't know. But whatever data becomes available, we will use that intelligence to go into that area and make sure that we bring solutions.
Will the screening also include the screening of the drivers themselves? This is now the taxi drivers and the train drivers.
100%, because they are at risk. They are exposed to all manner of people all the time, and they are possibly, if one gets infected, could be carriers. Like I said, if you are sending change back from the driver to give 5 rand to the second row, they may then be the spreader of that particular virus unintentionally, So to try and stop that dissemination and the spread of the virus, we must make sure that they are included as well, especially when it comes to educating them and informing them about this virus.
Okay, thank you so much, Ayanda Allie-Paine, the spokesperson for the Department of Transport.